You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode.
To our listeners out there, I am super excited to have you all here today, tuning in to this episode of the Mom to Mom podcast. I am Nikki. I'm a birth doula with How to Mom. You may recognize me from being interviewed with Stephanie Sinclair on a few previous episodes, but I am taking over today's episode. So don't hit pause and don't back out. You're going to want to hear this for sure. I am not only thrilled to be hosting this episode of the podcast today, but because our guest is actually a very, very dear friend of mine, and is a leader in the chiropractic world with a niche practice here local in Minnesota that I can't wait for him to share more about with you. And I am just so pleased to welcome Dr. Chad Burckhardt of the Wellery. Hi, Dr. Chad.
Hello, Nikki. Good to see you. I'm happy to be here, and I am excited to kind of dive into some things for sure.
Yeah, I'm really excited to hear some perspective because, and I hope that you share a little bit more about this. But one thing everyone should know about Chad is that he not only is extremely passionate about care, but he's really passionate about education. And that's one of my most favorite things that comes out of the Wellery is all of the education that he brings to the public. So I hope that you get a little plug at the end and talk about maybe some things coming up that you have going on. I think it's really important, not only that you're putting care into people, but you're also educating them as well. So I love that about you. So I'm going to let Chad sort of tell me a little bit about, how he got started. I want to hear everything from, I said there's a niche to your practice. So I would really love for you to tell our listeners what that is and why. Why did you choose that?
Yeah. So it's my 15th year in practice, and I got drawn to chiropractic because I was an athlete, keyword on the was, in high school. And with some injuries, and I went to the chiropractor. There's one specific time I sprained my ankle on a Monday night. I went to the chiropractor, got some things done, got it adjusted, and I was able to play that Thursday night. And my coaches were like, what happened? Like, you were like limping around, right? I was like, I think the chiropractic guy helped me. I don't know what's going on. So that kind of got me down that road. And in chiropractic school, I want to be working with athletes because I was one, and that's how I got introduced and just kind of fueled my passion for that. And then about 2-3 years into practice, I realized this stinks. Like, athletes are horrible to work with. No offense to the athletes out there, but they want to be better yesterday. And I was one of them, right? I want to be better yesterday. I don't really want to do what you tell me you want to do, just fix me kind of type thing. And I was like, okay, this is good, but like, there's lots of other chiropractors out there that can really, that's their niche, right? Is to help people perform and things like that. And we do some of that with our youth athletes as well. But, I didn't get as much enjoyment out of making sure, Bob could golf on Saturday. It's okay, good for you. But it's like, it's kind of like, there's got to be more.
Yeah.
And then we had a mom come in with her baby, very colicky, was crying the whole time in the care room. And I was like, okay, what's going on? Well, she's like, I heard chiropractic can help with this colic thing. I don't know. I'm just exhausted. And for those of you who've listening that had a colic baby, you're anything will work, right? You're just like, I don't care. Flip them upside down. Let's go walk backwards, sing, kumbaya, whatever it might be. I'll try anything. Yes. And at that point in my chiropractic career, I was like, yeah, totally. But inside, I'm like, I don't know, maybe. Let's see what happens.
Worth a shot.
So I'll never forget, it was an intern with me at that time. and we just adjusting the baby, and adjustments for the baby, right? You can't tell that you're doing anything. There's no cracking or popping or twisting. It's just subtle things. I tell parents, it's like when you go to the supermarket, you're trying to like test the firmness of a tomato, just a little bit of just constant pressure. And so I'm over looking at this baby. I'm holding constant pressure around her C1. She's just screaming her head off. And like, that's making me anxious. It's like, oh my gosh. And all of a sudden she just stopped and she smiled, and then she went to sleep. And I'm just still had my hands on the baby. And I was like, look at the mom. The mom looked at me. The intern looked at me. The intern looked at the mom. I looked at the intern, and I was just like, holy crap. And I was just, and internally, I was like, yeah, that's chiropractic works. That's what's supposed to happen. So all your friends.
That's
but
the plan.
Oh man. So the feeling, like selfishly, for the feeling for myself is like, I want to do this. This is amazing. This like changed this kid's life. This changed the family's life. This is like, this is a whole new perspective on the world. I was like, I want to do that. And so ever since that moment, 12 years ago, 13 years ago, I was like all in with pediatrics, all in with pregnancy, and full family wellness. And we built here at the Wellery in Maple Grove, we built, that clinic where it's like our people are the people that want to not only they're eating right, they're moving their bodies, but they view chiropractic the way we view it is it's like it's just part of their lifestyle. It's part of like, we do this. We do more chiropractic when we're sick. We do more chiropractic when we had 3 baseball games in a week or whatever it might be. We do chiropractic for ear infections and colic and reflux and all these things. And so I've been very fortunate. And I'm super glad I'm not working exclusively with athletes anymore, because this is way more rewarding. And as you know, right, Nikki, as a doula, like that is a special moment to be in this family's lives and to bring them through that moment and to be that's way more fulfilling than most of other jobs. So I feel super fortunate. And like I tell people, like, hey, if you're having a bad day, just come to the Wellery, hang out. You get baby giggles, have kids running around. Like I get paid for this. This is cool.
Yeah.
So
well, I love the backstory. I mean, I feel like Chad and I have known each other for a very long time. And little fun fact about me, I also was in the chiropractic world. That's how we met, actually, is through some chiropractic friends. I worked for many different chiropractors for a span of 10 years. And so not only am I an avid patient, my children, upon hours of being born, both of my girls were adjusted within hours of being born. So I love to hear how you got there. I mean, I knew the athlete piece of it, but I love that aha moment that you just shared. That was really cool. So thanks for being there for the family, because you're so right. That mom probably went home and just like cried tears of joy that day. I hope she did. I hope
she got some sleep too.
Yeah, I hope she got some sleep. But for the love, I hope she got some sleep. And I think it's really telling too, because I mean, you mentioned the baby was colicky, so I definitely like want to dive into that too on some of those things that you see or anything. But one last thing, he mentioned he invites people, just come. You're having a bad day, come to Wellery. Please check out their website. Please, if you get a chance to stop in and meet them in person, Chad and his wife, Melissa, have created the most beautiful space, and it is so welcoming, so calming. There's a kid's space. It really does feel like you can just be yourself and be maybe a little crazy that day as a family or a parent. Like it's all, no one's judging. It's a judge-free zone. But so I'm glad you mentioned that, because I feel that. I think it's great.
Yeah. Thank you for those kind words. And it's, we just had literally Nikki yesterday, because we're constantly, following up with people, and we do a decent job. I feel like we always can do better. We do a decent job of making sure that we're meeting families' goals and checking in, and we'll get into some of these things about some of the scans that we do too. But on the initial intake, so like after a month of care, we always ask, okay, what can we do better? What do you like about the Wellery? And she said, it feels premium, but it's very cozy. And I was like, we nailed it.
I love that. Premium, but cozy.
Yeah. So, we always say, like, we want you to feel a little bit lighter walking out than you walked in. And it has nothing to do with chiropractic, right? So we just wanted to get the good vibes and pass them along. So, yeah.
Well, I think you're accomplishing that. You're doing a great job.
Thank you.
Yeah, absolutely. I know this part, but I was hoping that you could dive in just a little bit for our listeners because I think it's a really phenomenal story. Can you talk a little bit about your time in India and what that did for you in the just personally and then from the chiropractic standpoint? I'd love to hear you tell that story.
Yeah, so that was September 2016 to May-ish of 2019. Melissa, my wife, was working at Target at the time, and we're walking into a workout class a Friday afternoon, and I open the door for her because I'm a gentleman like that. And she's like, I think I'm going to go to India. I was like, Indiana for a workshop? She's like, well, I've been offered a job to work there. I'm like, okay. So we're with friends, and so we can't really talk about it, right? Because it's so fresh. And so we're doing like push-ups. Like, what are you talking about? Like, so we went through this whole thing. And then we went to happy hour afterwards. So we really couldn't talk about it. So we get in the car. I'm like, what in the H is going on? Anyway, she got this promotion basically to go over to India, Bangalore, India, through Target. And it was one of those things where I was in a very successful clinic as associate, starting to, work the peds thing, really feeling good about that. But there's just like, for me professionally, there's like, there's got to be more. I went from athletes to working with more kids, and then I feel like I can really up my game and really do more for these families. Mm-hmm. And so there's a little bit of a struggle because they just weren't set up for that. But it was a good job, and it paid the bills, and it was really good. But so that time away, and I'm sure people can relate to this. You step away from things, you're like, things become real clear. Right. So we went to India, which was an amazing experience. And it's just crazy. And, it was never on my radar to like go visit, but I would tell anyone, you have to go to India. It's unlike anything else in the world. But professionally, it really just took me time to step away and realize that I really want to go all in. I feel like I was 75% of this pediatric thing. I'm like, I'm all in. Because in India, I was one of 4 like actual chiropractors in the whole country of 1 point whatever billion people. Yep. And so I was busy. Yeah. And a lot of it was there was no wellness. There was just like, help me doctor, I can't walk. Help me doctor, I've had all these MRIs. Help me doctor, because they're riding on mopeds and it's a hard life.
For sure.
And so that, as much as I will always look back with really a lot of gratitude in helping those people, it was more of an education like what I don't want. Because that's, it's exhausting. There's just people just taking from you all day energetically. And there's no like, hey, Bob, what'd you think of the Timberwolves game last night? There's no like back and forth. There's just all like, help me. It's like, oh, I'm trying, I will. But so, and I've spent some time with boys home and volunteered there. And that was just super gratifying. And actually spent some time once a week adjusting kids with our HIV positive. Mm-hmm. And they would go to another like pediatrician. Yep. And he would come back to what's going on. These kids are HIV positive, are healthier, and have less issues than the kids that are, the kind of normal population. And it's like, I would like to think that chiropractic played a small part in that, because we'd adjust them every week, and just getting their nervous systems connected and all the things that we'll talk about. But I dove all in at that point and never looked back. And that was where the Wellery got dreamt up. It was in a hotel in Mumbai, and Melissa, my wife, is in HR, and she wrote our playbook and our team, all that stuff. And it was, I almost get emotional now. Like I look back, I was like, holy crap, that was a big moment. So now we're about 65% pediatrics. We see a lot of full families, like full family wellness, like you mentioned. And that really just galvanized, or like I was able to put those pieces together. And then when you dream up your own business, you kind of like, you can do it your own way, which is awesome. And also you're the person, like we said earlier, like he's like, oh, it stops here. So get your ass together, make it work. Yep. But it's been really fun.
Okay, you guys, we're going to take just a brief break so I can tell you all about an amazing company, Body Ready Method. Body Ready Method is an amazing company that offers pregnancy and postpartum programs. I urge you to take a look at this, especially if you are wanting to stay active during your pregnancy and prepare for labor and delivery. This is also a great program to help heal and recover your body post-birth. You can go to howtomom.com/links and follow the Body Ready Method link from there. Okay, back to today's episode.
I love hearing that story. And I've heard it so many times told in different ways in different environments, but here it just feels extra special. And I mean, seeing it come to fruition and seeing all of the progress that you have made professionally, Chad, is just really exciting. Not personally as a friend to see you, but just knowing what you're doing at the clinic is really special. So I'm really excited you were able to have that experience in India with Melissa. It sounded like a massive jumping off point for you.
Mm-hmm, for sure.
I mean, let's talk a little bit about too, I think it's a great and interesting thing to talk about the nervous system. I think some people listening to us today might think of chiropractic as a lot of, pops and cracks and things like that. I think that's very general, what a lot of people might think of, but I'm too far in. I'm too deep in chiropractic. I know all the things. I know what it is, but but I want to hear from you. Like you said, you brought up colic, you brought up ear stuff, you brought up when people are in pain, right? So so tell me sort of, your process when families do come in. I think a lot of they're coming in with something, right? Like I think that's very average, but so how do you talk to families about what it means to be well instead of just in pain?
Yeah, I think just like any profession, everyone looks through certain things through a certain lens, right? And so our lens is very nervous system focused. And, all chiropractors say, well, nervous system focused too. It's like, well, are you, so the first thing we do when we come in, I think what we really could distinguish us from a lot of other places, we dive in. So if you say, let's make a scenario, you have a baby with reoccurring ear infections and you've heard chiropractic can help.
Yeah.
Well, we're diving into what was pregnancy like?
Yeah.
We're diving into what was the birth process like? What was the first, few months like? Because we know that the more physical, chemical, and mental stress that we feel, that gets imprinted in our nervous system. And when we're pregnant, everything that we experience, the baby is experiencing too, right? Whether that be physical stress, chemical stress, or mental emotional stress. And the big things that we find are for the baby is the mental stress that birth parents are experiencing just around being pregnant, around the birth process. Unfortunately, I think there's a lot of fear care in the pregnancy world right now of certain hospitals and things like, okay, it's just kind of like a cover your butt kind of type situation. There's a 1.5% chance this might happen. So let's do daily ultrasounds, or there's all these things happening. And, we're at home, we're working, we're, not as active maybe as we were, like our grandpa and grandma, our grandmas were, right? They're so many generations ago, they're out, they're moving in the field, they're moving their body. And that's really good biomechanically. It's good nervous system wise. They're eating all organic. They didn't know organic was the thing. It was just food, right? Now we have to actually, things that are food aren't really food, right? So all these things are really stacked against us nervous system wise. And so we go through that process. And then really for us, the birth process itself. And I don't have to tell you, right, Nikki? You've experienced it on both sides of how we bring babies into the world. C-sections are life-saving for mom and for baby. I think we've really normalized them. I think it's become just like, oh, okay, let's just do this. It's fine. Instead of maybe, that's why I love doulas and midwives, because we can help birth parents get to that birth story that they want. We can move them in that right direction of, there's a big difference between, I walk parents through the exercise of like, okay, imagine it's Thursday morning, you're in Italy and the sun comes up and you're like, you can smell coffee and you stretch and it's, oh, this is good. What are we going to do today? Let's do this. Okay. Versus someone in the middle of the night, it's 4:30, it's pitch dark. They yank the covers off you. They shine lights on you. They start poking and prodding you and whisk you away. Right. That's the difference of some of the bursts that we experience. And kids are like starting their life like that. Yeah. I mean, that would shake you for days. That would just shake you. They're starting their life like that. They don't know any different. So they're wired into that fight or flight protection. The world is scary. I'm navigating air for the first time. I'm navigating gravity for the first time. And all of a sudden, I don't know where mom is. I'm not feeding, all this mess, right? And so birth process is a big nervous system trauma.
Mhm.
It's physical, it's chemical, it's mental, and that gets imprinted. And then, it's the trouble latching. It's the we're not moving as well. We're getting constipation. We're getting all these things. And so we can add these things early in life. And then maybe at 2 years old, we're starting to get ear infections. Well, it's still nervous system stress. It's just showing up different.
Right.
We look back in that traumatic physical stress of the birth, the chemical onslaught of lots of antibiotics. And so all of a sudden that baby, what we call, gets in that storm, and like that nervous system is tons of stress on it. And it's really wired into that fight or flight, right?
Right.
So you can't be in growth, which we want babies to be in like 100% of the time, right? They should eat, poop, and sleep.
Yep.
You can't be in growth and protection at the same time.
Correct.
So if they're in protection, they're not eating the way they should, they're not pooping the way they should, they're not sleeping the way they should, and that adds up to, obviously, a lot of issues. That's that baseline neurology. If we can get those done, awesome.
Right.
Then let's move to motor control. Okay, are we turning our heads? Are we getting up on all fours? Are we crawling? Or are we skipping crawling, right? We go
big one.
We get these parents like, oh, my baby's so advanced, it's so strong, it can move its head at one day and it was rolling over at 3 weeks. It's like, I hate to tell you, that's just a lot of tension, right?
Yeah.
This is a lot of tension to baby. Baby should be right, like cooked noodle, right? Nice and floppy, right? So if you're handing your baby off to Uncle Joe and it's just like you're doing like a football, that's an issue, right? Like we need to like
one of those fainting goats, like the ones that
exactly.
We don't want babies like that.
And the fainting goats, that's cute, but you're basically putting them in shock. Their nervous system's overwhelmed. Like, don't do that to goats. Can we start a campaign? No more fainting goats. That's really mean. Don't do that.
We don't support it. Let it be.
I do not support that. Put that on the end of the podcast.
And the Wellery do not support fainting goats.
Yeah, exactly. Yeah. And so then they have ear infections, and like we say, we're dumping antibiotics on it, and they come to us usually as it's not like, oh, I have my baby starting to tug at their ear. Let's see if chiropractic can help. It's after 5, 6, 7 rounds of antibiotics, 2 rounds of tubes. And there's like, well, let's try anything. Right. And so the neurology behind whether we're talking about ear infections or colic or reflux or anxiety, ADHD, I don't want to simplify it and take my words out of context here, but it's all the same thing. It's stress in the nervous system. It's a disconnect between the brain and the body. The body's supposed to heal. The body's supposed to be nice and calm. The body's supposed to do all these things. But when there's a disconnect there, there's stress stuck in there, you're going to have issues. We see ear infections. We see behaviors. We see that sister and brother are biting and their aggressive behavior and whatever it might be. What we're not looking at is, well, what is the body telling the brain? Because the brain is just going to process. Sometimes we get lulled into that. The brain is this like master puppet control thing where it controls everything. Well, to a certain extent, but the brain is only as good as what the body's telling it. And so think of the brain more as like an air traffic control, right? It gets information in, it'll spit information out.
Yep.
So if the body is not giving good information, it's kind of garbage in, garbage out. And so you just kind of have this cycle where we're going through life and we're growing and we're doing things, but things are really hard.
Yeah.
We're missing some maybe language or vocab or motor movements or digestion, or kids are, these are the kids that are like constantly sick all the time. These kids in your life, they're runny nose and they're constantly can't kick any colds and they're have this constant cough, or their vocab is behind, like I said, or they skip crawling. I mean, it shows up in so many different ways, but we can look back and say, okay, what's the common thread here? We look back on that history. Well, what was birth like? Like I said, what was pregnancy like? What was those first few moments of life? Those first few years are so important. And you and I and everyone listening are walking around with some stuff that we either were aware of or not aware of that happened our first few years of life, because that's when that nervous system is developing. That's when things are really getting imprinted. And yes, we can change those. Yes, we're getting better about neuroplasticity and that the brain can change. It can make new wiring. It can do that stuff. And if that wasn't true, I wouldn't have a job, right? So we know that's possible.
Yep.
But it's, I got so long-winded, I don't even remember your question.
No.
But that's basically basically what it comes down to is we want to make sure that nervous system is clean and clear as much as we can of stress. And when that happens, we can heal, we can grow, we can do the things that we need to do.
Well, I think you hit it too with, and I love that you bucketed into chemical, mental, and physical. I mean, and we talk about that as doulas a lot, right? So when we're planning, we're working with a client with their birth plan as an example, we ask them, what are you okay with? And I think one of the biggest things that people don't understand is something that might sound really normal, because in a hospital setting, as an example, like cervical checks. So when you get in, you get a cervical check right away. That's just what you do. And part of our job too is to make sure that you have choices. And so I'm using that as an example because cervical checks for a lot of women are an insane amount of stress on the body, on the brain, and you just can't get past that. So sometimes people like, nope, I'm definitely going to want to know where I'm at, how far am I dilated? I want to know. But that signal is sending that down to your body, to your brain. There's so much tensing up that can happen. And so even like talking about it from that perspective, from chiropractic to doulas, we're all met every part of life. There's some sort of tension, there's some sort of stress that's going to come at me. I can't ever avoid it, but if I
Correct.
can manage it well, if I have a team. So, how do mom folks out there, you'll hear us talk a lot about your birth team. And that doesn't just mean your partner, your doula, your doctor, your midwife. That also means your chiropractor, your acupuncturist, your pelvic floor therapist. We have so many options out there. And they're all here. You heard Chad talk about it. He's here. They're here to help you. They're here to help support you during pregnancy, before pregnancy. Even if you're planning on getting pregnant, there are so many things and so many ways that you can be taking care of your body with a chiropractor, with all these other phenomenal practitioners, right? And then
I'm glad you brought that up too, because and a lot of people listening to this most likely have had some loss, right?
Yeah.
They have problems conceiving, and honestly, that's your nervous system's way. That's your body's way of saying, we are not ready. There's a disconnect. We cannot support another human life. We can not sustain this, right? And so, like you said, like preconception even, right? Like how are we getting healthy? Are we checking the chiropractor? Are we going to acupuncturist? Are we moving our body? Are we eating well? Are we doing those things? You're right. It takes a team,
right.
And the biggest team member is yourself, right? Check yourself. It's like I always tell people, like, make me look smart. Do your things, right? So,
Yeah.
But it's like you guys have phenomenal resources, and you're a huge part of the community, and so you have really good people, like we do. Of like, I think you need this, and so I view you and I view us as kind of that quarterback, so to speak, for families, for expecting people. Okay. You get such great care, individualized care, and say, hey, I think let's bring this person in. Let's bring this person in. Because it does. I mean, it takes a lot of people. Back to my point about, 6 generations ago, we didn't need all this probably, right? But as much as I love to feel like the universe in general is conspiring for us. It's trying to put things in our life and do all these things. Yes. Also, there's a lot of things going against us when we wake up. God, I wish I could have. I always reference this study, but I can never find it. So I think it's true.
It's out there somewhere.
Yeah, it's out there somewhere. We're like, the average American woman is exposed. It was ridiculous, like thousands of chemicals before they leave. Well, when we used to leave the house for work.
Right. Yeah.
You think about all the food, the shampoos, the lotions, the makeup, the fabric stuff, and all these things. It's like, so before you leave, your body's constantly having to work. And then we could go down all these rabbit holes about food and lack of movement, all that stuff. But so you really have to be really diligent and really an advocate for yourself, and have people on your team that are in your corner, and they don't have an agenda, and they don't have they don't want to put you in a certain box. And that's what, you guys are phenomenal at that of, I know it's kind of a cliche and like a word, but empowerment, you want to give people choices, right? You want to give people choices. And that's why I love what you guys do. And a lot of doulas or great doulas out there that what way do you want? Okay. Have you thought about this? Right. And there's there's certain things that maybe in your world are, I wouldn't say non-negotiable, but you kind of feel strongly about, right?
Sure.
Things in my world are like, yep, okay, and have you thought about this, type things. And so just meeting people where they're at and trying to get them down a road where we can have a successful birth, or we can get rid of ear infections or whatever it might be.
Yeah, no, and I think that's a good point too, is, the community part of it all. I know you're a part of a really great pediatric forward group. Sorry, I'm forgetting the name of it right now. What's your group called?
Yeah, it's Pediatric Experience. And so
Thank you.
It's grown really. I think there's like 600 docs now all over the world. And so we, the things like all of us, right? Like I didn't wake up one day knowing all this stuff, and these things are constantly changing and we're constantly figuring out more. It's like, I just went to my naturopath and she's like, Chad, you're not getting enough protein. It's like, well, I kind of knew that, but now it's like, now we're like, protein's the thing, right?
Yeah.
People are not getting enough protein. Like, and now all of a sudden, fat was an enemy. Now it's, it's for us, it's like salt was the enemy. Now actually we need, some salt. So it's like, we're constantly navigating these things, and through the birth process too. What we thought 20 years ago was, that's the way, that's the gold standard, isn't anymore. So we're constantly evolving. So you guys do too. You constantly have to be educating yourself on what is the kind of the newest, best way. And sometimes the newest way isn't the best. We're getting really good at automating things and doing things. And so I think that human interaction that we both are lucky to have in our professions is huge, because you cannot discount just being in a room with, for me, loving, intentful hands, right? And sharing that energy and sharing that space. Like, I could maybe be a really, really below average chiropractor, but if I am really present and my intent is just pure, just love, man, they're going to get better. They're going to get better.
1000%. Energetically, it means something. I mean, I think it means something when, we're in the room with a new family, and, maybe something, the path looks different than what the birth plan was. Right. And so sometimes we might be with a partner or dad while mom and baby are being taken care of. And there's a lot of scariness there. There's a lot of unknowns there. And so as doulas, we talk so much about, obviously we're there empowering mom, empowering birth mom, supporting her and baby, but really it's far more all encompassing than that. And the same with you, right? You're taking care of families as well in that way, but there's nothing that can replace that feeling that I think you and I both get when we see happy families, healthy families, everyone just kind of innately doing what they should be doing and trusting each other and just loving on them so hard. So I agree with you. I think that's like the ultimate, that's my gold standard. That's why I'm here. That's why I'm doing what I'm doing. I know you're doing this work for, the same exact reasons. And I'm just super happy to be in a group with you, in a community with you, that I know in a second I can call you and be like, hey, I've got this going on. Can I send this person to you? Can they have a consult with you? Tell me a little bit about how, if anyone listening today wants to kind of walk in and see you, and how would they get some care?
Yeah, sure. So we use 3 scans, neurological scans. And so what they are, they're surface level, meaning it's not like an ultrasound or an X-ray. So I guess first we send kind of an extensive intake online because we want to figure out your story. I said every child, everyone that comes in has a story. It's our job to like really listen and figure out their story. And there's lots of parts of their story that they don't think is relevant. And so we try to flush a lot of those things out. First of all, and then we get scans. So the first one we do is a thermal, so meaning temperature. And one of the main jobs of our nervous system is to regulate temperature. And if you're living in the Midwest or Minnesota, you know that, right? About a month and a half from now, it's going to be 95 degrees. And then you're going to walk into the movie theater and it's going to be 55 degrees. And so your body and your nervous system is going to spend a lot of energy trying to regulate that. So we use that to our advantage. That can show us areas of stuck stress, like we say, where if the right side of your C1 is a way different temperature than your left side, it doesn't say there's pain there. It just says, okay, doc, let's check here. The nervous system isn't doing what it should be doing. So that's a big one for babies, because they can't tell us like, doc, it's here, just C1.
That hurts.
As of yet, I have not had that. Another one which we use a lot for kids with like ADHD, focus, behavioral type issues, is a surface EMG, where we actually can see, like we talked about earlier, what is the body telling the brain? What's the energetics there? If it's really, really active, think of that as like a decibel level, 11 out of 10, right?
Yeah,
Is it nice, calm, soothing, symmetrical energy that the body's telling the brain? Well, great. Then the brain can process that. It can organize that. It can have some impulse control, right? But if I start yelling at you incoherently, that's obviously a lot of stress for the brain. And the brain's just like, I don't know what the H you're talking about, but you need to run. You need to not focus, not sit in school. You need to like hit things. You need to like tap your toe. You need to like get this out because you're giving me so much energy. I need to get that out. And so that's one we rely on a lot. And then HRV, which people may have heard of. If you have a fancy watch, you can have that. Dude, my smart bed has HRV on it. Like, how are you testing my HRV? And I'm like, and also, I'm not going to sleep on an iPad all day. Like, I disconnected that thing. I don't need you telling me my heart rhythms and like weird stuff. So anyway, sidebar.
Does it talk to you also?
No, yeah. I crawl and it's like, welcome, Chad.
Hey guys, it's Stephanie Sinclair, founder and owner of How To Mom. I'm just interrupting today's episode to make sure you are well aware of all that How To Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How To Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode.
So HRV is heart rate variability. Like I said, if you have that fancy thing on your phone, so that can tell us, like, is your system stuck in fight or flight? Is it rest and relax? I tell people, like, we want you going down the interstate like 60 miles an hour. You can speed up if you need to, right? That's fight or flight. We need that. That's survival. That's if we're working out, if we're doing certain things. And we should also be able to break. And so that's our rest, digest, grow. That's, obviously really active when we're sleeping. So we want you to be kind of in the middle of that. And so we put that all together. And then obviously we do a physical exam. And so we take the physical exam, the neurological exam, what you are telling me as a patient or a parent, and then we come up with a plan. And I think this is one thing where I think people maybe have had an experience or get a little scared. I don't know if scared is the right word, of these like huge, gigantic like care plans. And I go to the chiropractor and I always have to keep going. They tell me to keep coming back, So there is a care plan. I say we care plan because we care, right? If you're trying to like help with anxiety, ADHD, colic, whatever it is, it's going to take a series of adjustments, right? Babies, it shouldn't take a ton, but if you're a 12-year-old with some serious anxiety and ADHD, it's going to take a few months. It just takes time for the brain to basically rewire and to try to do things in a different way. And we also say a lot like percentage of life. If you're a 6-year-old and say you're having some vocab issues or you're having some behavioral issues, and we look back at the things we talked about, well, we had lots of ear infections. It was a really, I was in labor for, 20 hours. We were pushing, ended up having an emergency C-section. We've had ear infections. We've had all these things. Well, there's lots of stuck stress in there that we need to unwind, right? And so we usually can get to the kids and people to where they want to go, but that's kind of the gist of it. The first 2 appointments, each one takes about a half hour, and we give you a first adjustment as well within that, because we want kids, especially parents, adults are like, yeah, okay, I've been to a chiropractor, I'm good. But I think for parents and kids to experience that adjustment and realize it's very subtle. It's not TikTok chiropractic where there's lots of, cracking and popping. And I have somebody, in these leotards with a microphone there doing this. And so that you can hear the pops, it's like, oh my God.
That's really a bummer to know that you're not adjusting in the leotard. So.
But you've seen those, Nikki,
How unfortunate.
Like, wow. Is your whole practice just like 22-year-old women in bikinis? Yes. Wow. That's weird. Like, huh. Anyway. And so it's very subtle. And so they can experience that. And it gives us another rep to like getting the kids into space. Like you mentioned earlier, like if you're a kid that has like sensory issues or even an ear infection kid that's 2, you've been poked and prodded and people have been around your head and your neck. And it's not been well. It's not turned out great, right? It's felt good. So they have fear and anxiety around that too. And so if we can come in, you can spend some time coloring, you can hang out a little bit, and then we can always get to where we want to go. But just for kids to feel comfortable that there's not weird doors and like we shut the door behind you and there's this weird adult like, coming at you.
Right.
Because like I said, we're here to calm nervous systems, not create anxiety, know? And so a lot of times parents will call and like, I don't know, Johnny he just hates doctors and he gets really anxious around new people and he doesn't like it. And we haven't had anyone yet that has refused to like, let me adjust him. And I always say, okay, I understand that. You're going to have a hard time getting Johnny out of here. He's going to want to come back. Right. So that's a huge part of, how we built the Wellery. Like you had those kind words in the beginning of parents need to feel really comfortable. They need to know that they're in the right spot. They're going to be taken care of. And kids do too. I mean, as seeing that dyad, right, they feed off each other. So if mom is really anxious and she's not sure if this is right, and kids are going to feel off that and vice versa. So to make them feel comfortable and we redo the scans every 12 visits to make sure we're on the right track. We're not just going to keep adjusting to adjust. We want to make sure we're getting subjective outcomes. But I love the scans because it gives parents and really myself objective data. It's like, okay, I have this colic, I have this reflux, I have these behavioral issues, whatever it is. Well, here you go. Here it is. We had a 16-year-old in 6-7 months ago, and this is what happens when we have that stuck stress for so long. The body just starts to go, okay, we cannot keep this up, and we start getting some like depressive type behaviors and moods and things like that. We start doing some withdrawal. And he's like, after we showed him the scan, he's like, this is the first time where I could like see someone showed me like why I'm feeling this way. And so it's not saying that we're going to fix depression. It's just saying if we can get stress out of that nervous system, then the body can do and the brain can do what it needs to do. And so it's kind of cool. That was kind of a aha moment, even for me, years into this, like, oh yeah, you're right. These are a really valuable tool. And I can't imagine practicing without them because they're really like the Google roadmap, so to speak, of like, where are we going? Where's that stress moving around? And so like I said, it gives parents a lot of confidence too, especially if there's, stereotypically the mom comes in, and the dad, rightfully so, is the protector, usually, right? And they're like, okay, I want to protect my money. I want to protect my family. I don't want to waste my time. And so they're the person to be like, no, this is good. And so we can show them like, here it is. Like, here it is, So it's really good on that way too. And obviously we want people to see the value in it, that we want them to feel comfortable. We want them to be on board because they're going to get better outcomes with that unless, versus someone that's coming in, and they don't feel like we're the right spot. And so we want to make sure that families have the care that they deserve, but also the environment that they deserve, and obviously the outcomes that they deserve as well.
Well, and you said confidence. And I think that that's the undercurrent of all of this, as giving the families the confidence that they are in great hands, but also that they're being heard. I think a lot of times, like you said, some kiddos have probably gone through a total gamut of doctor's visits and maybe ENT and, all these invasive things. And, maybe they're being told it's possible, like, well, it looks okay. It looks fine. It'll just go away. It'll go away.
They'll grow out of it. Yeah. They'll grow out of it. Yeah.
It looks normal. Yeah. You'll grow out of it. And so I think as a mother, I can speak for myself, like, every piece of great advice I've ever gotten has been to trust my gut. And so, for anyone else out there listening today, I think that's sort of also what we're telling you is trust yourself, trust your gut. If you just don't feel right about something, have that confidence to speak up and advocate. And yeah, it is work, guys. There's no getting around it. It's work to keep up with ourselves, keep up with our kids. There is no real cruise control, but to your point earlier, maybe we can just pad the brakes a few times here and there, give ourselves a little bit of a break, and then, start to ease in a little bit more once we kind of get things under control.
Exactly. We all have those seasons of life, right? And so, you're in your world, Nick, you're in a huge season and a huge chapter in families' lives, right? And so it's when you have those big moments, it's really important to give yourself grace and to trust your gut, and not be, I think what I mentioned before, not get into that fear care model, and having a doula, having a chiropractor that you can bounce ideas off of, just a trusted source. I really hope for everyone that's listening and everyone in the world, but like to have that at least that one person in your healthcare team that you really trust. It doesn't mean they're always going to be right. It doesn't mean you're always going to agree, but you're going to get good information, honest information, without agenda or whatever it might be, that you're gonna get options with. You can talk through things, and I know you gals are that for people, and we hope to be that as well. But that's so huge, because in this landscape, in this world, it's tough for OBs and medical doctors and things like that, because they're overwhelmed. Like, they are overwhelmed, they're understaffed. There's just a lot of things going on. And a lot of times their job is to keep you alive, not necessarily thrive, not necessarily really get you and your family to really optimal health levels. And that's just the way it is. And that's why you and I exist, is to show them options and to show them other, roadmaps that can really help them and their families.
Absolutely. And lean on us, out there, lean on us. We're here for you. That's the whole point of, even doing these episodes. We want to make sure that that we're actual human beings. We're out here, we're doing the thing. We're here to do the thing for you if you want. And then if we're not it, we know a million other people. So community is everything. Support is everything. Dr. Chad, I am so grateful for your time today. Thank you for sharing all the things chiropractic with us. I think we could do like a whole 80,000 part series, because there's so much to talk about.
Well, as you can tell, you get me going. It's you're like, oh, in my brain, I'm like, wrap it up, Chad, wrap it up. So you did a great job. Thank you for getting some of that stuff out of me. But and I would just say, like, really appreciate you, Nikki. Not only, obviously we've have a really great friendship. We met through chiropractic, like you said, but the work that you're doing and Stephanie's doing, and really appreciate you guys being a source in the community. And I always tell people, give me a call if you think even if you don't think I can help. Give me a call. It doesn't cost you anything to call. Spend some time. As you can tell, I feel strongly about things, and I really love talking about these things. So give us a call anytime, and I will talk to you. You're not going to get packed around like, oh, the doctor's busy. Like, that's such BS, man. You became a doctor, like, help people. So help people.
Yeah. We're going to link all of Dr. Chad and the Wellery's information on this episode, but just for fun, their website is thewellerymn.com. Give it a visit. It's awesome. You can also sign up for a consultation on the website as well. Their phone number's there, and just learn a little bit more if you're interested. Again, they're in Maple Grove. Please check them out if you're in the area. And again, thank you so much, Dr. Chad. We just adore you and appreciate all the information and help you give our people.
Yeah. Thank you, Nikki. Have a good rest of your day.
Thanks for listening, everyone. See you next time.
All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.